Hi, good morning, everyone. My name is Dr. Derek Adu-Sarkodie. I'm a GP. I work in the Northwest. I'm a lead GP in my practice, and I'm also a clinical lead for workforce and education. So I cover my whole region as well. I've got a real passion for education and teaching, and I'm really excited to be part of this whole program today. Now, I'm going to share my screen and we'll talk about, the stuff that we'll be covering today. So in particular, we're going to be discussing men's health today. Looking at prostate health and other problems like erectile dysfunction. But the main thing that I want to impress is that we want to really look at how men's health, in particular, and these different health issues, how they affect Black men. And that's the reason why I'm here today, because I feel really passionate about empowering people with information to know what to do and how to make better health choices. So I'm really excited to be here today. So we know that Black men face diverse health issues, so including erectile dysfunction, prostate problems, premature ejaculation. So we'll cover all of this today. These concerns can impact both the physical and mental health well-being as well. And there are unique health challenges, which I'm going to go through in a little bit, especially in relation to prostate and sexual health. A lot of this meaning that people are probably not aware of what to look out for. And these unique challenges might be delayed presentation to a healthcare provider as well. We have got disparities in prostate cancer rates and sexual health outcomes. And this really does kind of stem from genetics, access, and also cultural influences. So we're here to change things. We're here to expand your thinking and also to get you to spread the information out. I think this is a really great program as well. So I'm going to go through a lot of topics today. Part of my role as well, I have a YouTube channel called Adu-Med, and a lot of the topics I'll go through today, I'll break it down in some simpler forms on that YouTube channel. So if you do come across anything that you wanted a bit more clarification about, make sure you check out Adu-Med on YouTube. Perfect. So let's start off with prostate problems. Now, the prostate is an almond-shaped organ. It's located in men, is just beneath the bladder. So you can look at the picture on this right-hand side here. So you can see the prostate here. And what the prostate does is that it produces enzymes that enrich semen in men. Now, there's so many different problems that can affect the way in which the prostate actually functions. So it could be enlarged, so we call this benign prostate enlargement. It could be infected, we can call this prostatitis, and of course we've got prostate cancer. So if we have a look at this picture on the right-hand side here, you can see that the prostate can sometimes get enlarged. So we call this term benign prostatic enlargement. And this enlargement gets more common as patients get older. And looking through here, this tube down the middle is where the urine flows out of. So if the prostate gets enlarged, you can see here that it can press on this tube, which is why you can get some problems. So I'll talk to you about the symptoms as well. Now, the rate for benign prostate enlargement is about 41% greater in Black men as compared to the white counterpart. So it affects us more frequently. And symptoms could involve, the urinary symptoms, so problem passing urine, straining, and having a very weak stream. Patients may also be waking up several times at nighttime to have a wee. Risk factors include age. So in the UK, about kind of 50% of males over the age of 50 will have some form of prostate enlargement. And this actually gets higher the older patient gets. We've also got family history, which is particularly kind of important when we're talking about Black men. So if you've got a father or other family members with prostate enlargement, it's more likely that as you get older, you get it as well. Got certain hormonal changes to the male hormones. We talked about ethnicity and also certain lifestyle factors. So let's talk about how we actually treat the symptoms. Well, I'm always an advocate about having lifestyle changes. That's always the first thing as well. So what can you change to reduce these issues with the waterworks, with these urinary symptoms? Well, it's important to reduce how much caffeine that you have in and alcohol as well, because these can all irritate the bladder and cause you to have, go into the toilet several times as well. So it's important if you're excessively doing any of these to really try and limit this as well. And just, taking less fluids before bedtime will mean that patients are needing to use the toilet less frequently. We've got certain medications as well. So I'll explain to you how these medications work. We've got medications called alpha blockers. This is a group of medications, and one of them is called tamsulosin. Now, the way these work is that it relaxes the muscle, it relaxes the smooth muscle that surrounds the tube through which urine flows out of. So the urethra, that's what it's called. So when this muscle is relaxed, urine can flow so much easier. And so patients that have problems with the waterworks, it can work really well as well. We've also got other medications that we call alpha reductase inhibitors. So an example of this type of medication is one known as finasteride. The way these medications work is that they basically shrink the prostate. And a smaller prostate will mean that, it's not as large, it's not pushing on that tube through which your urine is flowing out of. Surgery is also an option. And a procedure that's done by the urology team is one known as a transurethral resection of the prostate. Now, basically all it means, so transurethral, so like I talked about before, the tube through which your urine flows out of, that's called the urethra. So transurethral basically means that a scope is inserted through the urethra, and then basically the prostate, bits of it are kind of removed and excised to help to kind of deal with these symptoms. So let's move on and talk about prostate cancer. Now, this is a condition that is, affects so many people. And, I've got personal, family members and stuff like that have suffered with this condition. 1 in 4 Black men will actually develop prostate cancer during their lifetime, sorry. So it's really prevalent within our population, and this is compared to 1 in 8 for other men of other ethnicities. Now, the exact reason for this increased risk is not really clear, but in Black men, it may be connected to our genes. And also it's known that Black men actually receive prostate cancer diagnosis at a more advanced stage. And I'm sure you're all aware that, the later that we pick things up, it basically has an impact on the treatment and the treatment outcomes. So why are Black men more at risk? I touched on this before, but we do have certain genetic differences that mean that prostate cancer is more aggressive in Black men. And also a really interesting point here is there's a clinical trial gap. So we are underrepresented in clinical trials. So this really hinders specific and tailored treatment, as well as the research as well. So this has an impact, quite a wide-ranging impact. And I alluded to this earlier on, but there are access challenges where, some patients have limited access to care and screenings. And this can all lead and all kind of add up to these disparities that we see. I hope that makes sense. So risk factors. So kind of similarly to our previous condition of enlargement, we've got age, family history, we've talked about ethnicity, genes, and also diet and lifestyle. So particularly having kind of sedentary lifestyle, very poor diet, full of, high fats and stuff like that, that can all have an impact. So we've got kind of screening tests as well. There's a blood test that's done to screen for this condition. It's called a prostate-specific antigen, a PSA. Now, this blood test is used in conjunction with an examination because, like a lot of stuff in life, the blood test isn't a perfect test. So if you had any symptoms with your waterworks and in an older Black male, your GP would possibly examine you and then arrange the blood test. So we combine them both together. And there is a screening as well. So at this point, it's mentioned that Black men with high risk can be screened for prostate cancer by having this PSA blood test. And this is done between the age of 40 to 45 years old. And that's done, like I said, alongside with an examination too. And the treatment of prostate cancer is quite a wide range. So Watchful waiting basically means that with prostate cancer, it's quite a slow growing cancer. So if a patient has a very mild form, the team that they're under, the urology team, will probably just wait, just see how things are developing. You probably have regular blood tests, regular examinations, and as long as things stay quite stable, that's what it is. So that's watchful waiting. Some patients might need surgery to remove the cancer if it's particularly more aggressive. We've got chemotherapy and radiotherapy, and this is done really if it's quite an aggressive cancer, and sometimes it's a combination of one or more of these things as well. Good stuff. So moving on, let's think about erectile dysfunction as another condition, another men's health condition that could have an impact as well. So erectile dysfunction occurs when a man has problems in achieving, maintaining, or sustaining an erection. And this can have a really negative impact on the physical as well as the psychological health of men as well. And I like to break it down into our psychological causes and also our physical causes. So thinking about psychological, obviously anxiety, depression, stress, a lot of stuff that can have an impact and cause erectile dysfunction. Also got our physical causes. So we've got high blood pressure, diabetes, and some medications, in particularly our SSRIs. So these are antidepressants. So this form of antidepressants can sometimes cause problems with sexual function. We've got alcohol, which we all know, smoking, and also a low level of male sexual hormones. So in terms of kind of screening for this, well, patients will have kind of annual screening. And the thing with erectile dysfunction is that it's important to find out an underlying cause. So we talked about psychological causes, but there are some physical causes as well. Stuff like, diabetes, and having high cardiovascular risk. So blood tests to look for your blood glucose and also for your cholesterol are really important as well. So if there's anything that can be reversed, then that would be great as well. And then also blood tests to look at your hormones, like your testosterone, and that would be really helpful as well. And to look for a particular cause of this condition. And treatment is just if there's an underlying cause, especially psychological, this which we need to be addressed and corrected as well. We've got stuff like counseling, which can be really effective. And a healthy diet, it makes such a big difference. Changing and making those lifestyle changes can really improve symptoms as well. Reducing your alcohol intake, avoiding symptoms, avoiding smoking. These are all things that can really have an impact on these symptoms. So it's a real empowering tool here that patients know that, there's a lot that they can do. It's a lot that you can do to manage these symptoms as well. Of course, there's certain medications that help to increase the blood flow to the penis as well. And this could be used if no particular cause is found, and take it from there. And then more advanced treatments will include a penile low intensity shockwave therapy. Good stuff. So let's talk about testicular health. This is really important. I think it's important that each male is aware of what is normal. So that's why we've got self-examination. So you have to know what is normal for you, just so if something is abnormal down the line, then you're able to, realize it and get that checked up as well. So you know your risk, and if any issues or anything untoward, you get a medical checkup as well. Good stuff. So we've gone through quite a few different things, quite a few different kind of conditions. But it's important, I think, for us to realize that, there are certain specific challenges and psychological struggles that we encounter as black men. So, we've got here kind of stigma and this challenge of masculinity, which can cause issues with coping with all these different expectations as well. And that can have more of an impact on mental health. We look at conditions such as anxiety, depression as well. And obviously, there's also some patients who have communication barriers as well. So I think if we look at some of these barriers that we as black men face, there are several different solutions as well. Important thing really here is culturally sensitive care. So mental health service should be really tailored to cultural needs as well. And it's important to be open. There needs to be a bit of a dialogue. That's why we're having these sessions. There needs to be some kind of dialogue about health issues. We need to be interested in really improving the health of the community as well. Access is really important. So, in the NHS and in wider health, we need better access to healthcare, including mental health. It's not just about physical health as well. And this whole thing about support, there are several challenges that we do face as Black males, but we can support each other. We can create support networks, kind of being brothers through these difficulties, sharing different experiences and, lean on that as well. And we can really go far in addressing some of these difficulties that we do have in this community. So I'm really, really happy, and thanks for listening to me for this time. Just to conclude, Black men's health has several different, the topics that it can span. We've covered a few of them today. We've looked at prostate health, sexual health, and also we've looked a little bit about mental health as well. We talked about how we can all come together to open up a dialogue, really support each other, and overcome the stigma that comes sometimes with seeking help as well. It's really important that the care that is being provided is culturally competent, and also access is improved as well. And we talked about regular screening. We talked about prostate cancer and how this further enhances proactive health management. Great. So thanks a lot for watching today. Like I mentioned, if you need to reach out to myself, I've got a YouTube channel called Adu-Med, which will cover some of what we've talked about today in some more detail. And like I said, thanks for watching me. I also want to thank Dr. Ajidahun, who puts on these slides together as well. And yeah, thank you so much. See you later.